I think there are a couple of specific points that are unique to Intermountain Healthcare and what we're doing in our precision genomics program. One of those is that we are really providing an end-to-end comprehensive service. We have a robust molecular tumor board that provides interpretation of every single sample that is tested. And then we also have drug procurement services. So we will go to the length of helping physicians obtain a targeted drug for their patient, regardless of what insurance provider that patient may have.
Our first patient was a gentleman that had a colon cancer. He was just about to enter hospice, just looking for the last option. When we sequenced him, we found that he had an ERBB2 mutation, which is generally associated with breast cancer. So we gave him a medication targeted toward that, and we were able to extend his life in an additional 16 months with minimal side effects compared to what standard of care with chemotherapies would give him.
One other aspect of what we're implementing at Intermountain Healthcare is the ability to search all of our data in an easy and digital way. So Syapse is enabling us to take all of our molecular data and our clinical outcomes data and put that in a searchable format so that we have one database that we can search with easy standard terms. So I can look, for example, at our database and ask questions about the frequency or prevalence of certain mutations in certain tumor types. I can ask questions about which alterations have been targeted with which drugs by various physicians. So the data-rich aspect that comes from our partnership with Syapse has really transformed the way that we're treating patients.
Everything that we are able to do grows from our ability to work through Syapse. It also allows me to extend my program beyond the Intermountain walls. So the Wasatch Front, which is St. George, Utah, the southern tip, 90 minutes from Vegas, all the way to southern Idaho. Now I can extend that beyond those boundaries into the region and actually the nation because of Syapse.
Syapse has really enabled our efforts to clinically implement genomic medicine. So using clinical cancer genomics to guide treatment for patients has identified treatment options and given hope to patients that didn't have treatment options and didn't have hope. It's also given physicians an opportunity to identify treatments that otherwise they wouldn't have known about. It's given physicians confidence when they didn't have confidence about next steps, and all of that really is enabled by the Syapse system.